Did you know that anxiety problems are one of the number one causes of sleep difficulties for adults? And as it turns out, the same can be true for kids. Because when you're a little kid with a big imagination and you are thinking of all kinds of scary monsters and stuff that might be in your room, it can be very hard to sleep. Hello and welcome. This is Dr. Brett Pearce, child psychologist, and today I would like to talk with you about sleep time issues with kids. Not necessarily going to cover the topic comprehensively, just because that might take several videos, but I am going to talk with you about what I feel to be one of the number one issues for kids with sleep. And it's especially one that is very often overlooked, and that is the subject of anxiety and scary thoughts and monsters that we're imagining that can keep us awake at night. I don't know, these are cute if you ask me, not scary, but hey, it's a matter of perception. So, I've talked on this channel before about anxiety in kids a little bit. It is a very big issue. And it's a very big issue even if your child does not have like a diagnosable anxiety problem. We all have the capacity to feel fear and anxiety, and kids are even more vulnerable to it than adults because they don't have the same kind of brain development or experience and maturity to be able to handle it on their own. So a few general comments about sleep before we dive in. So number one, for some reason, as a species, I guess, but I mean, it's probably largely cultural, we often expect pretty little kids to be okay sleeping on their own in a room by themselves where they can't see or hear or get access to their parents. And for many kids, it turns out to be perfectly fine. I'm not too worried about it. But it's just an interesting thing because in general, lots of our cousins and fellows in the animal world, particularly mammals, kids sleep right next to their parents because it's a safety thing, and obviously in the modern world there's very seldom any legitimate safety concerns. However, those instincts for kids, those instincts that say if I'm away from mom and dad, particularly when it's all dark and scary and I can't see them, then my anxiety is going to get going, and I'm going to be nervous and scared. So there's lots of great resources out there about the importance of doing things like using a sleep, like bedtime routine kind of thing, where we're slowly kind of ratcheting down and helping the kid kind of lower their level of energy and activity so that we can soothe and get ready for bed. And I can certainly talk more about that in another video. But as is my usual style, I like to hone in on issues that are often overlooked or misinterpreted. So one thing that I'll remind us all about anxiety is that anxiety gets our fight or flight response going. Anxiety can make us look really irritable, really restless. It can make us look obviously fearful, However, it's not necessarily terribly common that kids always show fearfulness in all situations in this obvious, like, I'm scared kind of way. It's not uncommon for the fear to be represented more in just this kind of nervous, keyed up, irritable, maybe even kind of argumentative and a little defiant sort of way. So very commonly, parents I work with, the first go-to in terms of how they're framing the issue and therefore choosing to intervene with the issue when kids are having a hard time separating for sleep, because that's your first clue, is the kids going, oh, I won't let you go, mom and dad, I don't want you to leave the room so that I can sleep because I get too anxious. But the first go-to, of course, with parents is that it's easy for parents to say it's a misbehavior, right? My kid is being defiant and it's a misbehavior, therefore I need to set limits and dole out consequences and things like that. And when you're talking about a kid whose fight or flight reaction is already kind of on overdrive, you can see how that is like throwing gas onto a fire. Because when we confront a kiddo on something, which we often have to do, but when we confront a kiddo at 9 o'clock at night when they're supposed to be in bed at 9:30, then what's going to happen is their adrenaline is going to get going. So this is the first big point that I want to make about dealing with sleep issues, particularly when we're suspecting that anxiety is involved, is that we have to be really careful about setting limits in this kind of confrontational way. And for those of you who know me, you know that I do not shy away from a confrontation when it comes to misbehaviors with kids. It's just that I'm also inclined to think of whether or not a confrontation is really the appropriate tool for the job. So we have to set limits in a lot more gentle and indirect kind of ways. Like, oh shoot, I am so excited to finish this book with you, and I'm really excited for you to put that toy back away so that we can get back up in bed and we can finish the book. Rather than put the book away now or else, put the toy away now or else no more book. We just have to be really careful about setting limits in like a sort of a firm and direct way, at least when we're trying to help a kid deal with the bedtime routine. The second thing that's important for us to think about when kiddos struggling with anxiety and sleep time issues is we have to, deal with the anxiety itself. Meaning for many kids who have some anxiety about sleep time, being away from their parents is just too much for them to handle. And so they just stay awake and their anxiety's going and their adrenaline gets going, and then they're not going to sleep anytime soon. If you've ever had a situation where you were sleeping and then you had a really horrible nightmare, or you heard some sound in the house and you thought that someone was breaking in, and so you snapped awake and had to go check, you're probably not just falling right back to sleep, because that fear and that adrenaline is, it's powerful stuff, and it's going to wake you up and keep you up for a while. So we have to be open to thinking like, okay, well, what can I do to help the kid deal with anxiety? And it's good for us to think of like, well, what other kinds of situations would we not expect the kid to handle that on, his or her own? Couple of ideas. Would you expect a kid to go into a doctor's office by themselves entirely, if they were really fearful? Probably not. You'd probably be like, oh, he's a little too scared for that, I'm going to be there with him. Would you, I could go on all these examples, but the point is, we're pretty inclined to think in many other situations about what is an appropriate expectation for a kid, and how we can just provide some extra support and be present to help bring the kid's anxiety down. And the same should apply for sleep time. So I can tell you that with kids who are struggling with sleep, particularly when I think that anxiety is the likely culprit, and that's very frequently, I get great results just saying, hey, let's have you stay in the room with the kid until the kid falls asleep, and then stay in there for another 5 or 10 minutes to make sure they're settled and really getting into some good sleep, and then just quietly leave the room, or have the kid sleep on a cot in your room for a while. And then predictably people go, oh my gosh, isn't that going to make it so that the kid wants to stay in my room and sleep in my room with me until he's 20 years old? And the answer is no. Kids are very naturally inclined to build greater and greater independence. It's a normal developmental task. And at least in attachment-oriented thinking, there's a term called the paradox of safety, which is to say, the safer we feel, the more independent we become. It's usually the presence of fear and the lack of safety, at least perceived safety, that tends to make us want to cling on to things. It's never a problem to just say, hey, let's just provide more presence and support to get the kid's anxiety down. And then once the kid gets used to sleeping normally, then we can start to break up those kind of mind and body habits that were helping to kind of fuel the fear in the first place. So the two big things that we really want to think about with sleep time difficulties in kids are, number one, be careful about setting hard and fast limits where you're really confrontational with the kid, at least when you're helping the kid with sleep issues right around bedtime, because all a big confrontation is going to do is kick everyone, including the kid, into overdrive. And that's not going to help a kid, particularly if they're struggling because of anxiety. And number two is watch out for anxiety, because it's a really big thing with sleep time issues. And one of the easiest ways to handle it is to just provide more presence and support. Maybe stay in the room with the kid until they're asleep. I know it's challenging if you've got more than one kid and a lot of different things to juggle, but believe me, you'll be better off just putting in the work right away to break up those habits rather than allowing them to just kind of perpetuate. Because anxious kids who are not sleeping well, it's not going to help them do better in general during the day, and it can cause this kind of snowball effect with behavioral and emotional difficulties. And as always, this video and all of my videos are not meant to substitute actual consultation or treatment from a professional. So if you really feel like you're struggling with a kid when it comes to sleep time, please do chat with your pediatrician or a child mental health professional like myself. So thank you for listening. We've talked about sleep issues today and how anxiety is a very common culprit, especially with kids. This is Dr. Brett Pearce. If you enjoyed this video, please do subscribe. It really helps out the channel. Give me a thumbs up and smash that bell notification so that you can be notified when my next video goes live. And I will see you in the next video. Thank you.